Acid-base determination. Determining acid-base starts with looking at blood gas or ABGs. It's important to know normal blood gas values. Normal pH ranges between 7.35 to 7.45. When determining acid-base, a pH of 7.4 is used. Normal PCO2 ranges from 35 to 45. When determining acid-base, PCO2 of 40 is used. Therefore, in acid-base, a pH of less than 7.4 is considered acidemia. It's leaning towards the acid, while a pH greater than 7.4 is considered as alkalosis, leaning towards the base. When a pH is less than 7.4 that is leaning towards the acidemia, it is important to look at PCO2 value. If PC02 is greater than 40, then the acidemia is caused by respiratory acidosis. Causes of respiratory acidosis include hypoventilation, which are caused by obstructive sleep apnea, opioids, COPD, and muscular weakness. On the other hand, if acidemia, that is pH less than 7.4, is observed in a patient with PCO2 less than 40, then it's metabolic acidosis. When blood gas points to a metabolic acidosis picture, it is important to categorize metabolic acidosis as either anion-gap metabolic acidosis or as non-gap metabolic acidosis. Anion-gap metabolic acidosis. Causes of anion-gap metabolic acidosis include uremia, diabetic ketoacidosis, lactic, methanol, ethylene glycol, salicylates. Non-gap metabolic acidosis, on the other hand, is caused by diarrhea, normal saline infusion, renal tubular acidosis, pancreatic fistula, and carbonic anhydrase inhibitors. Of note, salicylates causes both metabolic acidosis and respiratory alkalosis. If it's determined that patient has non-gap metabolic acidosis, it is important to evaluate urine anion gap. If urine anion gap is 0, then diarrhea is likely the cause of non-gap metabolic acidosis. However, if urine anion gap is greater than 0, then renal tubular acidosis is the likely cause of the non-GAP metabolic acidosis. Now let's take a look at a situation where pH is more than 7.4 in the next video. Always talk to your doctor to discuss your care.